there, Kelly Hahn here with Hahn Fitness. I'm a certified personal trainer and a mom. This segment we are going to talk about how to work your upper back and shoulders. These muscles oftentimes get lengthened and therefore weakened when we're pregnant because our larger chest, our larger belly draws our body forward. So we want to work on strengthening the shoulders and the upper back. So one of the most important things to think about is posture, making sure we're always thinking about standing tall, drawing our shoulders back, sitting tall, and also drawing our shoulders back. And then some of the different exercises you can do. The first one is scapular retraction. So for that, it's a very subtle movement, but all you need to do, you can do this standing or lying, is put your arms out, and then you want to think about as though you're trying to squeeze a tennis ball between your shoulder blades. So you're here, and you just squeeze and come back out. So squeeze them together and bring them back out. You see, if you notice, I'm not bending my elbows, just a slight bend in them, but I'm just drawing at the shoulders. I'm not bringing my entire arm back. And the next one is upright rows. So for that, I'm going to grab a kettlebell. You can use a dumbbell as well, and you're just going to come up, come right to about chest level. You can come even with your shoulders and bring it back down. You don't want to go too high, so just right there and bring it down. This will help strengthen your shoulders and your upper back. Good. And the next one, front and lateral raises. So for that, we're going to use dumbbells. Front raise, you just hold, you can do palms down, nice and easy up, and bring them back down. This is also a great one for your core. You can keep your core nice and tight and work that as well. And you can also do thumbs up and come back down. Those are front raises. And then lateral raises is bringing them out to the sides. So you're coming out and bringing them back down. Just nice and slow on these. Good. And the next one we're going to do, it's a cross-body pull and press. So this is a really good functional movement. So you're going to start in a slight squat position, bring the dumbbell to the outside of your leg, pull up and press. Bring it back down. Pull up across the body and press. And you'll want to do that on both sides. And for all the exercises, you can do anywhere from 10 to 12 reps. Don't go too heavy on the weight, and do 2 to 3 sets depending on what you're comfortable with. All right, next we're going to do an alternating pullover, and we'll do that one on the stability ball. When you do anything on the stability ball, you want to make sure that your head, neck, and shoulders are supported. So you're going to roll down. You're going to put the weight straight up into the air, and you're just coming down with one and up. Start out very light on the weights for this because it can be pretty strenuous on the shoulders. And just go down to what's comfortable for you and bring it back up and alternate. So that one you want to make sure you keep nice and slow movements for that and nice and light weights. The next one we're going to do is seated external rotation. So you can sit in a chair or you can sit on your stability ball. We can do this one with a dumbbell or with a resistance band, so I'll show you both. But the key is you're going to start across your body and you're externally rotating it. So you want to keep your elbow and your upper arm glued to your side. One thing you can do to make sure you're doing that correctly is put a towel right here, and if it slips out, you're not keeping it close enough. So you're just externally rotating and back. Bring you over, we're going to do an inverted row. I have my TRX set up. You can also do this on a squat rack on the bar there. Makes it nice and easy to do. But I will show you on my TRX, which you want to make sure is nice and secure if you do use one of those. But you are going to come out, come down nice and low, and row. So squeeze those shoulder blades together, nice and strong. And there's a couple different ways you can do this. You can do it narrow, or you can put palms down and come out wide. And one other variation, which will work your biceps a little bit more, is to do an underhand grip and pulling straight back. So that's a great workout for the upper back. And those are some of the different exercises for your shoulders and upper back, which again, are muscles that oftentimes get lengthened and weakened during pregnancy, so you want to make sure to keep them nice and strong.